So I work in advocacy, and I also work on research development. I work for amfAR, which is the Foundation for AIDS Research, and we've contributed a little bit more than $360 million in investments to HIV research across the globe since the beginning of our organization. And of course, we find ourselves existing at the nexus between, innovative research developments and how they actually inform public policy decision making. And I work in the public policy office, so I'm at the nexus of trying to make those research findings impact policy practice. Part of the nature of advocacy is that it's ever changing. There's not one model, I think, that works for everybody or for all contexts. And I think as more information gets out there about the issue that I work on, which is HIV, and the more tools that become available, I find that I'm working with different individuals and approaching some of the same issues and tasks in a different way with a different strategy. And a lot of that of late has, of course, taken on a very incredible lens into figuring out how to engage the public health workforce in a far more meaningful and in a tangible way. Not only because we've had important scientific developments around the role of antiretroviral therapy in both improving the lifespan as well as health outcomes among people with HIV, but we have this incredible new innovation in understanding that antiretroviral therapy also has an important role to play in prevention of our disease transmission in the global and the domestic epidemic. So I've traditionally been working a lot with clinicians who have, for the longest period of time, been working on the clinical environment and how to do a better job of providing care to people with HIV that are in the clinical system. But now we figured out that we have to go broader, and I want to figure out how we can empower more public health scientists to help us make the case for a lot of the different strategies, community system strengthening and health system strengthening that needs to go on in the South, in the rural South, as much as it needs to go on in sub-Saharan Africa, to empower more of the advocacy that's going to get the kinds of decisions made that we'll need to make progress. There's a role for advocacy in all professions that are doing work, because of course policies shape how we live our lives and do everything that we do in our existence. So one of the things that I could immediately see Johns Hopkins doing, and you already do a great job of public policy education within the public health program here at the institution, but certainly your efforts to really kind of push public health scientists out there to actually be present in communities and see how a lot of the research developments either have impact or don't impact, I think is hugely useful to the advocacy field down the line, because we find that when individuals get in environments and they bang their head against the wall, they recognize finally what the important role of advocacy is. And as part of our challenge in the way that we've designed the field, right? The incentive for public health scientists is to get published. It's not necessarily to make sure that their publications actually impact things down the road. So I think, with the respectability of an institution like, and the authority of an institution like Johns Hopkins, you can also impact the field of public health practice down the line. At amfAR, we've been quite good at showing really how you can make a business model out of making research outcomes real for people in a lot of different contexts. I think a lot of people are excited about people that actually want to make the work that they fund have impact. So a lot of people that want to invest in cancer research, but more people want to invest in a cure. And I think, the more that we're able to show people that you're not just investing in understanding how the HIV virus moves through the human system, you're saving lives and you're preventing newborn babies and parents of children that need to grow and be cared for long into the future, you're actually giving them hope and a future. And once you can actually make those research articles really real in the lived experiences of people around the world, people want to invest more. I'd just like to encourage Johns Hopkins to keep doing the work and to hopefully give the tools and assets that you have to people broader than just the institution. I think there's a community out there as well that is ready and willing to engage in advocacy that would appreciate a lot of what you can offer.